Hey everyone, welcome to GrowMed. In this video, we will look at the vector-borne diseases, the vectors and the diseases they cause. This is a very important topic from the PSM, and every year a question is asked on this. So questions are asked on the images or the disorders, or there are some important points related to these vectors. So we will look at all those things now. This will be a short and a quick rapid revision kind of a video which will help you in your last minute revision. So let's start the video. So in this image, as you can see here, this is the image of the Culex mosquito, and this Culex mosquito transmits Japanese encephalitis and filariasis. And the next image, it is of the Anopheles mosquito, and as in this image you can appreciate that this mosquito is sitting with the contact of the skin at the 45 degrees angle. So, and another very important finding is, as in this wing, margin of the wing, you can spot there, you can identify the black spots here. So this is also a classical finding seen with the Anopheles mosquito. And the disorders which are transmitted by this Anopheles mosquito are malaria. So this mosquito is also called as the sophisticated mosquito, as it breathes in the clean water, and the larva, it rest parallel to water surface. So these were some important points of this Anopheles mosquito. And also the malaria, it is very important topic, as questions are frequently asked on this topic: the treatment, then about the vector, then its stages, the Plasmodium vivax, then the Plasmodium falciparum. So it is a very important and a must do topic. Then let's move on to the next image. In this image you can see a mosquito which is sitting with a hunchback neck, hunchback posture. So it is sitting parallel to the skin, but its neck is bent. This mosquito transmits a lot of disorders like dengue, chikungunya, yellow fever, Zika, and the Rift Valley. So these are some disorders which are transmitted by this Aedes mosquito. So the important points which you must remember is its flight range is 100 meters. So all the airports are kept Aedes free for a distance of 400 meter. So this mosquito is called as tiger mosquito also because it has white and black strips on its body. So these were the three important mosquitoes and some points related to it. Now let's look at some other vectors. This image is of a sandfly, and this is also called as a flea beetle mus. And a very important disease which is transmitted by this sandfly is the Kala Azar. The next image is of a tsetse fly, and this fly transmits sleeping sickness. Next is the image of the itch mite, which is also called as the Sacroptus scabiei, and this vector transmits scabies. So it is a skin disorder and there will be itching of the skin. So this is called as the itch mite also. Then moving on, these two images, these are the images of the soft tick and the hard tick. So how can you differentiate between a soft tick and a hard tick? So as you can see here, the soft tick is something like this, the oval shape, and the hard tick, as you can see here, something, there's a hook kind of a thing. So with these features you'll be able to differentiate it as a soft tick and the hard tick. So this was my way of remembering and my way of identifying these ticks. So images also are very important because they can give you an image and ask that this vector causes which of the following diseases. Okay, then let's see the disorders. So the tick typhus, it causes Q fever, relapsing fever, and the KFD in outside India, and the heart tick causes tick typhus, KFD in India. So these are some disorders caused by the ticks. So along with these two important disorders, the tick typhus, heart tick, also causes tick hemorrhage, fever, and tick encephalitis. And the next image, it is of a rat flea, and a very famous question asked in relation to this is the bubonic plague. So it acts as a vector for causing the bubonic plague, and another very important disorder which is caused by the rat flea is the endemic typhus. So you should be able to differentiate between the endemic typhus, then the tick typhus, epidemic typhus, because these are a little bit confusing. But if you look at these terms through 2 or 3 times, then you'll be easily able to solve the question. Then moving on to the next image, as you can see here, this is the image of the louse. This louse also causes a lot of disorders, and let's look at them. epidemic typhus, trench fever, pediculosis, and relapsing fever. So these are some disorders caused by the louse. So as this images and the disorders, it's very important. I suggest you to take a print of this page or either write all these points in a paper and stick it on your study table, so that whenever you will look at it, it will be a revision for you and you will remember the things very easily. Because these disorders are not easy to keep in mind, because we get mostly confused with the mosquitoes and the hard tick, the soft tick, as the names are repeating, like the epidemic typhus, endemic typhus. So it's very confusing. So if you stick these images on your study table, it will help you and clear all the confusion. Then let's also look at some important contraceptive images which are asked in relation to the PSM. So the contraception and the emergency contraception, it is a very important topic from the Fmge point of view, because every year one or two questions are asked on this contraception, and this contraception is also asked in integration with the gynecology. So let's look at some important images. So the first image, it is of the Antara, and in this the contraceptive is the medroxyprogesterone, and it is an injectable contraceptive. So this is a one-liner asked, which of the following or the Antara is which type of contraception. So image was given and a question was asked that which type of contraception it is. Then the next, another very important image, the Mala N, and it is a combined oral contraceptive pill. Then Nikshay, it is a home-based pregnancy kit. Okay, then looking at some other important images like the condom, the male condom and the female. So how do we differentiate it? The male has a single ring and a female has two rings. So by this we will be able to differentiate it between a male and the female. And another very important image is this one today. So a question is asked giving this image, and which of the following is the content of this? So it was a spermicidal and it is the nonoxynil 9. Then let's look at some important IUDs. The first one, as you can see here, it is the copper T, and questions are asked on its shelf life that it works for 10 years. And 380A, it is the surface area in millimeter square in which the CUT is present. Copper is present, and it is a second generation IUD. Then let's look at the next image, the Lipis loop. It is the first generation and not used nowadays because it has highest failure rates, and it also causes sepsis, so it is not used nowadays much. And the next one is the Mirena, and it is a hormonal IUD. It contains the hormone that is the progesterone. So the questions are asked on its shelf life, so it is 5 years, and questions are also asked how much hormone is released per day. So this was a short video covering some important topic from the contraceptive and the vector-borne diseases. So that's it in this video, guys. You can join my Telegram channel. The link is given in the description box for more information related to the FMGE, and also follow me on Instagram. So that's it in this video. I hope this video will be useful for you in your preparation. Thank you so much for watching this video. Like the video, share it with your friends, and if you're new to GrowMed, subscribe to GrowMed. Thank you so much. Bye bye.